My name is Harvey Weber. I'm the Director of Emergency Medical Services here at Englewood Hospital and Medical Center. On behalf of the Medical Center, we are honored to be part of this commitment to minimize the stigma-free mental health and collaborate with our community leaders for this prevalent issue. I'd like to recognize the Englewood Municipal Alliance, a stigma-free task force, Joanne Valencia, a Program Director for Behavioral Health here at Englewood Hospital Medical Center, Phyllis Brown, our Director of Community Affairs, the Englewood Department of Health, the Englewood Board of Health, the Englewood City Council, Bergen Family Center, Defining Moment Foundation, St. Joseph's Outpatient Mental Health Clinic, and Vantage Health. As first responders, we provide basic and advanced life support through our EMTs, paramedics, and specialty care nurses. We are trained to deal with all types of crisis, including behavioral health. We're frequently the first ones on scene and to arrive. Therefore, it's very important that we have the tools that we need and deal with any patient that's in crisis and get them the help. Our behavioral health services and psychiatric department offers short-term care for adults over 18 and for geriatric patients over the age of 60. Patients receive individualized treatment by our nurses, psychiatrists, social workers, our occupational and physical therapists to make sure that these patients are back on track. When we work together, we provide the support that they need and safely and quickly as possible. I applaud the leadership involved in this important initiative to change the perception of mental health. Not only am I a healthcare provider, but I have a brother who suffers from schizophrenia and have been dealing with this a good part of my adult life. So understanding this stigma and the stigma-free environment, it's something that's not reassuring as a healthcare provider, but also as a family member. At this time, I have a great pleasure to introduce Deborah Baldwin, our Municipal Alliance Stigma-Free Task Force.
Thank you, Harvey. I'm going to start first by introducing our mayor. I'd like to have him make the opening remarks. Please come up, Paul. Mayor. Mayor Huddle. Frank. And thank you so much for joining us, Frank.
Thank you. I would just, can everybody hear? I would like to welcome everybody here, the Englewood Alliance, and all the good work that's done here in the city of Englewood that sets forth an exhibit, an exhibit for our entire state on something that's so important. Englewood's proud to be stigma-free, and I would just like to thank Englewood Hospital and everybody involved here, and I'd like to return the microphone back to you. Okay.
I'm going to keep this really brief so we can get right to the speakers that you came to hear. In the spring of 2015, during a health department wellness initiative called Walk with a Leader, a Board of Health member, Dan Daniel, struck up a conversation with Council member Wayne Hamer and our health director and health officer Jim Fedorko about the need to address mental health issues in Englewood. And then in June, a small group of stakeholders met with Jim and me, all hoping to make the community a healthier place. The county stigma-free toolkit was presented to them, and a plan for implementation was discussed. And by July, the city council and the mayor passed a resolution designating Englewood as a stigma-free town. I made a promise to the city manager and to the council that this was not going to be a meaningless resolution, and I think you can see here tonight that that promise has been kept. I didn't do it alone. The members of the Stigma-Free Task Force and the members of the Municipal Alliance, I'm going to ask you to stand and be recognized, please. Councilman Hamer and Councilman Cobb are both here. Would you please stand? Thank you. I want to thank all of the members of the Municipal Alliance and the task force for everything you've done to help with this effort tonight and with everything that we've accomplished in the last 9 months. There's a whole lot more to do, though. It's of significance, I think, that we learned of the passing of Patty Duke this week. We were reminded of her battle with alcohol and prescription drug use and her undiagnosed bipolar disorder. After her memoir, Call Me Anna, became a TV film in 1990, she became a mental health activist to help destigmatize bipolar disorder. But here we are, more than 25 years later, still fighting that fight. Those of you who live or work in the city of Englewood who are interested in being part of either the Municipal Alliance or the Stigma-Free Task Force, I invite you to sign up on the table in the back or send me an email after the event. I believe that the Stigma-Free Task Force needs members of the community to help us in the direction that we should go. Not just mental health professionals should be part of this. So if you want to help, we're more than welcome to have you join us. It is now my pleasure to introduce Ms. Vicki Sidrow, President and CEO of Vantage Health System, to present her remarks.
Hi, good evening. My goodness, how is everybody tonight? Thank you so much. Is that too loud? Should I step back? Step back. Thank you to Deborah, really, and the Stigma-Free Committee and the Municipal Alliance for putting this together tonight. It really was an amazing feat. Certainly the mayor and the city council who supported the Stigma-Free resolution, and Englewood for hosting it, and everybody for coming out tonight, so thank you so much. I could talk for hours about mental health and addiction, but Deborah only gave me 15 minutes, so, and besides, Eric is really why you're here tonight. I'm really kind of his warm-up act, but without any comedic or musical talent, so you'll bear with me for a few minutes. But it is my honor to share the stage with Eric A. Rouse tonight. While I don't know him personally, although I had the opportunity to speak with him a little earlier, I read his book, An American Resurrection, and his story is inspirational. I think you'll be spellbound. His challenges with mental health and addiction and how he's overcome them is truly a story to be heard. While I was reading the book, I saw some parallels in my own family. My brother, who has schizophrenia, was in the Navy, like Eric. My brother had a psychotic break, like Eric. But unlike Eric, who's really achieved amazing things, my brother has lived most of his life in a VA hospital, actively delusional and resistant to every medication or treatment that's been available. I think part of it had to do with medications really 30, 40 years ago not being available the way they are now. Excuse me. So growing up that way, and stigma means a mark of dishonor or disgrace, and certainly that was the way my family felt, so nobody really talked about it, and you weren't quite sure what the behaviors were about. But that's obviously still happening, right? I mean, stigma 40 years ago, stigma now. So for most of us who work in this field, I think, mental health, illness, and mental health is a very personal thing, as I know it is for Eric. When the Stigma-Free Initiative began a few years ago here in Bergen County, some of us in the mental health field were not quite sure, even ourselves, like what that meant, would it take hold, would people know what that meant? There's stigma about so many things, right? Gender identity, sexual orientation, ethnicity, even bankruptcy. People just have all these issues about. So, we were very happily surprised The information got sent out and really communicated very effectively. And now I believe it's 35 out of the 70 towns here in Bergen County. They're a stigma-free task force, which is really an amazing thing. People are talking about it, people are coming to events, people are activated in their communities, and it's really, we want to get the rest of the 35, right, Michelle? We're waiting, trying to get the rest of the 35. So if you know people in towns, I mean, it's on the Bergen County website, you can see who is a stigma-free town and who isn't, so join in. We're really proud, Vantage, to be part of this stigma-free committee. My assistant, Maggie Price, has trained 38 individuals in the city of Englewood, 20 police officers and individuals from the health department and Englewood Hospital and the Stigma-Free Committee on something called mental health first aid. It's likened to mental CPR first aid, where people are trained face-to-face in an 8-hour course. You learn about the signs and symptoms, excuse me, of mental illness and addiction, how to approach somebody. You know, you're not diagnosing, you're just learning how to approach somebody, learning the signs and symptoms, like I said, and then learning about where the resources are in the community. And as you know, Vantage is right here on Palisades Avenue. So we're doing a lot of that training, and it's available actually through the county and through Vantage and through some other organizations. So 1 in 5 people, adults, in the United States, or actually worldwide, every year will have a mental illness, will experience one. That's about 44 million people in the United States, 146,000 here in Bergen County, and about 5,500 adults in the city of Englewood alone. Additionally, 20% of children and adolescents also suffer from some mental or addiction. And suicide among the population 15 to 24 is the second leading cause of death in that age group. There's 21 million Americans 12 years and older who have had a substance abuse disorder in 2014. 2 million of those involved the use of prescription drugs. And half of that 21 million also have a mental health illness. So the numbers are just staggering. And the reason you're here, you should know why. The reason that only 40% of people get treatment is stigma. So 40%, only 40% people want to make that phone call for help because they don't want to tell people. They don't want to talk to their family members. They don't want to tell their friends. So only 40% actually get treatment. So we know it goes on everywhere, right? And it doesn't discriminate. Income, geography, age, race, gender, doesn't matter. And over the years, we've seen government officials come out, athletes, TV stars, and others talk about their addictions. And it was interesting that Deborah brought that up because seeing that Patty Duke die this week, her son made a statement that she was a blistering advocate for mental health, which I thought was a really interesting adjective. And said about her that the biggest impact, the most successful experience that she had was confronting her own bipolar diagnosis and then using it as a catalyst to help other people. The more we talk about mental health and addiction, create less fear, the more people will get help. The belief that people with mental illness are violent ranks among the most prejudiced and discriminating of attitudes. They are perceived as dangerous, when in reality, individuals with mental illness are more likely to be victims of a crime than perpetrators of one. However, we know that unfortunately there's been some tragic events over the years where people with mental illness have done some terrible things, and there's been a lot of violence and unfortunately deaths. And unfortunately that reinforces the stigma and people become more fearful. Those individuals had a mental illness, yes, but when you look at what happened, they weren't in treatment and weren't taking their medication. Individuals with mental illness are also perceived as those who can't live, work, or lead productive lives, and we know that is not the case. Taking medication, as we know, is crucial to an individual's recovery, and the development of the new psychiatric medications over the years, I've seen miracles. I've been in this business 30 years, and I've seen such major changes. We've even had individuals in our programs get married, and we're considered their family, so we've actually hosted those kinds of events. It's very satisfying. So if people seek the treatment and take their medication and get support, they can live, work, and have a life like you and I. Historically, people with mental illness were locked away, as we know, in institutions. And it was in 1963, a month before President Kennedy was assassinated, that he signed into law our Community Mental Health Act. And that law created federal funding to build community mental health centers. And some medications were coming out at the same time. So individuals started to be deinstitutionalized from the state institutions. And over time, inpatient psychiatric beds have closed down, and there's actually a shortage of them. And prisons and jails have actually replaced psychiatric hospitals as the primary facility for mentally ill individuals. In 2014, the number of jail and state prison inmates with a serious mental illness totaled almost 400,000. Since there are only approximately 35,000 individuals in state psychiatric hospitals, that's 10 times the number that are in our jails. But that's a whole nother topic. So in 1963, the Community Mental Health Act, Dumont had started as a child guidance center in 1957 in Dumont, and on $10,000 and a part-time therapist. And in 1972, we applied and became the first federally funded community mental health center in Bergen County, serving 11 towns in the Northern Valley. In 1978, the Englewood was created and served 14 towns in the southeast section of Bergen. We merged in 1983, so we serve collectively 25 towns, but over the years we serve now 3,000 individuals from every community, from every town within Bergen County. So we've grown a lot over the years. We have 130 staff, we have 9 psychiatrists, and 10 licensed social workers and addiction counselors in my Dumont and Englewood sites, serving all those people, children, a lot of children, adolescents and adults, with psychiatric evaluations and assessments and individual group and family therapy. And the top 2 diagnoses, which are the same globally, depression and anxiety, we see among all age groups. One of the most disturbing things, I think, though, is that we're seeing a lot of self-mutilation, cutting, by adolescent girls. And it's just, it's horrible, and just trying to understand how that's happening and why it's happening is very challenging. In Englewood, we run a day treatment center for individuals with serious mental illness, schizophrenia, bipolar. In Dumont, we have a day program for individuals who have both a developmental disability and a mental illness. We run a medical adult day center for the elderly, primarily Alzheimer's with a secondary mental health diagnosis. We have 82 adults in our residential programs in group homes and supportive housing across the county, and housed last year 40 homeless families here in Bergen County, with 44 adults and about 68 children. So we provide all sorts of in-home and on-site services for all those individuals. Our philosophy at Vantage is really one of hope and recovery. We know that people can recover, and we try and give them hope that they can do so and the skills to do it. And I know, too, that Eric agrees and espouses that philosophy. We know that individuals with mental illness can live a good quality of life. We know that. We also know that mental illness worldwide is more common than cancer or cardiac disease or a number of other physical health illnesses, yet the research, the funding, the reimbursements have never been at the levels they are for the physical health side. And it's estimated that mental illness costs about $173 billion a year in lost earnings. It's huge. And add to that the loss of productivity with the addiction side of the world, and the losses are just exponential, never mind the tragic loss of lives. The most major change, though, in parity for services and reimbursement for mental health and addictions came with the Affordable Care Act. There's millions of people who've been enrolled, and we're seeing some of the benefits of that, and actually the individuals are seeing the benefits because now they have access to care. But it's still not total because insurance companies can still choose not to have benefits for mental health and addiction. The other thing that the Affordable Care Act added was opportunities to finally, us in the mental health field and maybe my friends here at Englewood Hospital, to integrate physical and mental health. So the state of New Jersey actually was a little progressive in this, and they've launched a care coordination program to help serve those individuals, as people with serious mental illness die on average 25 years sooner than the rest of us. They have higher incidence of cardiac and respiratory and asthma and diabetes, and they don't have good access to care. So Advantage, we're going to be starting up this service in coordination and collaboration with North Hudson Community Action Corp., which is the federal qualified mental health center here in Englewood Hospital. We was talking to Joanne Venezia. We finally talked in the past, and we're finally going to get this going. So that on-site Advantage, there will be a primary care physician for maybe one day a week who integrate the care of the individuals we see with their physical health care. We are so excited about this because they don't get that care, and we can really help their quality of life and extend it, hopefully. So we're really excited about that. So we know that mental health and addiction are brain diseases, right? There was the decade of the brain, and all that research has shown when you actually look at slides, how if someone who has a psychotic break, how their brain changes, and an adolescent who starts to take drugs, the change in the brain. And the more and more you do that, the more and more it changes, and the harder it is to come back to normal. The Stigma-Free Initiative can help promote acceptance and actively challenge active stereotypes. Through powerful words and actions, we can shift the social and systemic barriers for those living with mental health and addiction conditions and encourage acceptance and understandings. The individuals suffering are our family, our friends, our coworkers, and our neighbors. They don't choose to be ill. And like diabetes, truly, if you manage it, you can recover. So I'm asking you to be kind and respectful to those 1 in 5 who are suffering with mental illness and addiction. Get involved in the Stigma-Free Initiative and take a mental health first aid course. There is hope, and recovery is possible. Thank you. Deborah, are you introducing Eric? Yes.
I'm not going to say another word, except it is my great honor to introduce Eric.
So hello everybody, my name is Eric Gayraz. I kind of like being introduced as Eric. It feels like a pain leg, just having one name and you're walking out. It's wonderful to be here. I'm somebody who gets the opportunity to go around the country. So when you get the opportunity to do something in your home state, a state which has seen your greatest triumphs and also has seen your greatest miseries, it's really an honor to be able to see what people are doing. In the state of New Jersey, I've been locked away in 3 maximum security psychiatric hospitals, and I've also been a state officer for Governor Christie in addiction. I was the co-creator of the first opiate task force. So it's been a real journey for me, literally from the streets. Really from the streets, from the absolute bottom of coming out of a VA hospital they said I would never get out of, being strapped out of a bed for 24 hours, to being able to come around and do the things I get to do now. The things I get to do now. And when I'm asked to come in and talk about stigma, it's often something that I think about, and we don't talk about the stigma that the person that has the disorder may oftentimes hold true to themselves. And I think about that because what I'm going to talk to you today about, when specifically making this presentation for you, is I had to overcome the stigma around mental illness first because my biological father had it. And I'm a kid from Exit 9, East Brunswick, and we had everything. And I watched the disease rip my father to shreds in the way that the disease does. It wasn't that my father was depressed and had a bad couple of years. My father followed the path of his mental illness. He was a Mensa member genius who was in the Army and eventually got an MBA from Fordham. And because we're from New Jersey, we understand what Patterson is like. And eventually, because my father wouldn't accept treatment, rather than stay with his family, he spent 10 years on the streets of Patterson and died homeless without me ever seeing him. So the hardest part for me in this journey, what I want to offer you today, is we're going to go in and out of a few things, and I'm going to make it very, very personal. But I do this for a living, so the idea is not to drive you into the ground. Okay? We'll come in and out of a few slides because, you know, if this is something in your family, it's difficult. And it's something we live with right now, my family. My nephew on my wife's side, from an adopted sister, was in Teaneck, and eventually went homeless due to his active symptoms of schizophrenia. And recently, as 3 years ago, I was on the steps of a train station trying to get him into a hospital. And I can't compete with psychosis. I can't stay awake, so I know what it's like to grow up with the phone calls that start when the family member is calling and acting and you're trying to do the right thing. You don't want to get the police involved because you're not sure how that's going to go. And the family becomes very small. And you become very afraid. And then to have that same disorder, to live through it. And now, where I tell you where I ended up, being very clear that the choice I made to stay in this and do the things I do involves a lot of suffering and pain. Anybody who does this work suffers. Anybody who has a family member with serious mental illness suffers. Anybody who sees these things around addiction and youth and suicide, all the things I work around on this, we suffer. So today we're going to walk through this, and we're going to come out the other end with my story, but you're going to be very clear to know that I'm one of the few people that you know who's going around the country trying to get into state psychiatric hospitals. Now, I own Trauma Institute in New Jersey. I've created the first ever statewide trauma-informed training for the whole Department of Children and Families. I've done all this wide open. I've done all this in the maturation of my own idea around what it means to have serious mental illness, and that it's integrated in all that I'm doing. Where I went through the state senate and got approved to be a state officer wide open. And because I was a volunteer and everybody else was getting paid, I did for 1 year and stepped off. But it was worth doing. If you're going to do these jobs, better get a little paycheck here and there. It was nice to do something. The reason I showed this painting, this is a painting by Picasso. It's called Guernica. And it's about the bombings of the Basque Lands, which were part of northern Spain. It's about the killings of innocent victims in the Civil War. And my last name being Abrams is Basque. And when I think about how things started for me and my family, it started around the destruction that went on in my family in the Civil War between my father and us. And I hate to say it like that because the hardest thing is, we all know NAMI, the National Alliance on Mental Illness. So in a very nice way, someone who's been held in restraints for over 24 hours. Last year I won NAMI's Gloria Huntley Award for stopping seclusion and restraint clinical practice nationwide. We're trying to. But what I told NAMI and the things that I do with them is oftentimes you'll hear people described as the family and the consumer. And I think about that with my father. I think about that once he got diagnosed, it was almost as if he was moved out. And I spent my father days, the days where we would celebrate Father's Day at Marlborough Mental Hospital in the early 70s. And how it started to seem like my dad wasn't a part of things. And if you ever learn anything about trauma and traumatic narrative, when people start putting their stories back together, they get it in chunks. And that's what this painting shows. It shows through cubism different subjective experiences. And when you think about the things you've been through, the most intense, sometimes you have words for it, sometimes you don't. And until someone can start putting it together, like great advocates like Patty Duke and others, where you can actually start seeing these diseases, not just in clinical terms, but in the suffering that you go through, to make them human. You know, really, when you're talking about stigma, what you're trying to do is you're trying to now discuss the experience of what these things are, not devoid of the clinical representation, but the humanity behind it. Nobody's ever felt better doing a clinical term. No one ever sat in front of somebody with a doctor and said, what's wrong with my child? And they give you all the diagnostic criteria for bipolar disorder. You don't feel any better. You might understand more. But you've all been there, if you understand this, when you're sitting there and everybody's nervous and trying to figure it out. EMTs are coming in the house, the police are there, and his family's exploded. And trying to figure out how to work through it again. If you ever do learn how to work through it again. But my family never did. I work with a lot of families where we're not taught what to do in crisis. Nobody prepares for an interpersonal crisis in a family. We all do the best we can when it hits. And we hope that we're going to hold it together. So when you think about this and the things that Vicki was talking about, especially here in Englewood and the other towns which are more and more closer to the city, we see people that go through terrible things that are mentally ill. People that are beaten on the streets. I spent years working on a consumer grant. I have a master's in employment and labor relations. I work in industrial relations. I left that job in 2004 and took a normal consumer job with the Choices program, the smoking. So I had a master's degree, and the only criteria that I had to meet to have this job for $800 a month was to work with somebody else on a mental illness, and I went to all the state hospitals. And I lectured about smoking, and I saw the people that were in partial care into the state hospital and out. I've been to Options in Patterson, Earth House in Newark. I've been in these programs, talking to the people, and I can't believe our lives ended up this way. Not understanding what we were seeing, and families not even being sure how to talk about it and to see what we're going to see. But the thing that I think is very interesting before I get more into the personal story is this work that they're doing up at Dartmouth, which I just did grand rounds up at Dartmouth Medical. And this discussion that they're talking about how just the experience of mental illness can lend itself to a PTSD diagnosis. That's how severe the experience is. And that's what we're really going to talk about today, because if I sit there and just tell you clinical terms, that's one thing. But I'm going to explain to you the sensations of mania. I'm going to hit you with what it's like to be in Rob Wood Johnson Hospital in New Brunswick in my last night episode in 2000, thinking I was giving birth and feeling it come out. And the hardest part about that is to know at that point I was married to my second wife, who I'm still married to, who had to sit there and observe that and watch these things happen. From a scholarship to law school, into an emergency room getting a phantom birth, to back in the psychiatric hospital. And trying to believe you can make it back to something. And trying to believe it after your father died that way. So, I do like this one slide if you remember anything, especially when I heard Harvey talking about the EMTs that go in. If you walk in and somebody instantly says that that person has schizophrenia, it almost instantly gets people on their heels. They feel that person is not cognizant to work with, mania. But to understand these diseases is to understand what the suffering is attached to the experience. We've seen the movies where someone has hypomania and they feel good and they're dancing around for 5 minutes. But once you see the disease really cycle, these are the things you're looking These are the miseries that people have, and that the families have. And this is what I saw in my father's face when he first started experiencing these symptoms. He was a very successful person. He had everything. This was the early 70s. If it's the early 70s, you have an MBA from Fordham, you served in the military, you have a 6-bedroom house with maids quarters, your life's going in the right direction. My mom is a beautiful black Irish woman from Brooklyn who liked the whole lifestyle. I still can't believe my mom tells stories about wearing a gold turban and thinking that she really had the whole thing going on. I think that was the biggest illusion I've ever heard. But that my mother, what I like talking to her about, for her to understand, and this is really for us all to understand, is she wasn't prepared for this to be her life. You know, when you talk to a family, families have their own idea of where they're going to go with things. They plan on things, they save, they think they're going to do these things, and then these disorders hit. And if they hit a member of the family, especially a parent, you lose everything pretty quickly. And you start getting involved in situations and parts of life you don't understand. And if you're me talking about stigma, the first feeling you have around mental illness is incredible fear. I was terrified of my father. I didn't understand what was going on. There's this uniqueness. I work in what's called neurophysiological cueing, which means that you can register back and forth off the face. It's hard to have a loved one when they start developing serious mental illnesses. You can't see it. They don't turn a different color. So but you can tell when they're not really moving with you anymore. When they're starting to worry about what they're doing. When things start falling off. And people start putting pressure on it. And what I started to see as I'm somebody who has a history of severe child abuse, is I could never tell when the violence would come from my father because he stayed flat-faced. And you'd walk in, and I'm not a small person, my father was bigger than me, but I was only 6 or 7. And the first time somebody hits you, when they're that big, and you just go down, and you realize that everybody else heard that too, right? I just gotta make sure, a lot of the table, so I gotta be sure all the way down. But I would think about what I was seeing in my mother, and I would see how she didn't have avenues back and forth. This wasn't a question of just someone being sick in the house. This was a question of someone losing their life in the house. This was a question of daughters who, to this day, have grown up without a father, and it affects them. And a son who was beaten so bad that I have a diagnosis of something called complex trauma, which means that I stay physiologically dysregulated. There's no treatment for it. My vagus stays dysregulated. And yet the person who had it the worst was Ina. And to watch Ina start cycling through this life, where when I think about this, especially the top part, which you see in medical sociology, and why it is important to have people tell their stories, is my father couldn't find a map to what was happening to him. Who do you turn to? Who's going to tell you how to make it back like that? Who's going to show it to you? The worst memory I have of my father, I have 2 of them. I have the one where, one is really worse to me now. I used to think the worst memories when my father tried to run me over. And I remember being in a Catholic school in East Brunswick. It was St. Bart's. My father had been homeless now for a few years and had that look of being homeless, when somebody really has everything they own with them. And he walked through this private school that was allowing me to still go. And we had gone from a 6-bedroom house to a 2-bedroom apartment, and I was sleeping on a couch. But you know, when you're young, you know, your family starts surviving. You start surviving, but my father would break in the house all the time. And he would just walk in. And I understand it a lot more now from what I do, but there was a terror around all of us. And when he tried to run me over in the parking lot, it hurt because I used to think I needed there to be emotion in his face. And I wanted to lie in the book. I wanted to sit there and think that there were tears and there was this, but the disease had taken so much of my father at that time that the memory I have is him barreling down on me. And I'm one of the few people, and maybe there's other people in here, whose one decision has changed his life, and that I planted my foot and I dove to the left, and if I dove the other direction, he would have gone over me. And I used to think that that was the worst part about what happened with Heiner, as this, citizen of New Jersey trying to figure these things out, but it wasn't. I remember now him sitting on a bed with me when we were in the house before he was eventually thrown totally out. And I remember my father crying. And I remember him just openly weeping, and he couldn't figure out what was happening to his life. And he was already getting to those places where you couldn't put it back together. And you would see him walk up to my mother and try to be intimate with her. You would see her move away. You would see his daughters stay away from him. And this registers. And the reason I know how bad that is because I eventually lived that. Because when he was gone, and I could see the hardest thing about the type of mental illness my father had that I have, is he doesn't just lose the idea of his narrative, and there are delusions that are physical. But there's a place where you get where every part of you is ill. And people stand right in front of you and they try to talk to you because they figure if they either talk slower or louder. It's like when you talk to someone who speaks a foreign language, you decide if you talk louder, they might hear the language and still don't understand type of thing. But when someone's in front of you and they're begging you to change, and there is no you there at certain stages. At certain stages, the disease is everything. And to have that as a history that I have took years to piece together just to even think I could have a life. And then to realize that those parts of my father were gone forever. When you think about stigma, when I think about my father and my own story, this is from a suicide researcher at Rutgers. His belief is that by certain identities, I use this with veterans in suicide, but I see it with mental illness and addiction also, is I'm somebody who's sober 20 years. And what you see different in addiction is somebody walks in and they get a personal narrative where they say, I'm an addict or an alcoholic, and everybody claps. And you walk into a restaurant, if everybody's been, I'm not asking if anybody's in recovery, but if you've been to a recovery meeting, they're pretty joyous. Like they're very happy. And I've said, I'm married, I'm an alcoholic, I'm an addict, and people are clapping and hugging me. But I've never had somebody say, when I say I'm Eric, I have bipolar 1 disorder, psychotic features, and PTSD, and complex trauma. People aren't like, that's great. That's so good. And what's important about stigma, and what we're trying to do today, is we're trying to put some of these disorders in the way that we describe them on a continuum where somebody can think that once they get the diagnosis, they can succeed. And that way, and in all the ways, especially as a mayor and a councilman, all the ways that a town can do a lot of that. When you see police and EMTs, and the ones who are going to be the first responders coming in, finding out what are the ideas that we hold about that in the first and second touches that people have in the community. Because you will see, especially what we did on that drug task force with opiates, heroin addicts don't like coming out and saying they're heroin addicts. There's even a difference between that and alcoholics in the sense of stigma. And I saw that in my father, and I saw that in myself. And when I first started getting symptoms, when I first got my diagnosis, all I knew is that I got my diagnosis 20 years earlier than my father. And then to eventually learn, which I'll show you a little later with the Adverse Childhood Experience Study, which is going to really show you a correlation between early life trauma and later life mental illness. It was all a weight loss program. So there I was, having this as my life history, without the ability to figure out how would I make it back to a life worth living. And the first time that I started experiencing mental illness was, I'm a disabled veteran from the United States Navy. I served in Desert Storm. And when I got out of what a lot of veterans do, I was somebody that's pretty good on tests. So I figured I would go to college, and I was in Memphis, and I was going to computer science school, and I had a 4.0. And I really thought my life was starting. And I was married to somebody who was pregnant by somebody else. We were friends when I was in charge of the female matters. And being that I was raised by a stepfather, I thought the best thing I could do would be to step in and raise this baby. And I did. And when I was in Memphis, I really thought I was going to have my life moving forward. And what happened back when the Knicks used to be good, that was the year that they lost to the Pacers, where Patrick Ewing missed a finger with. And I remember watching the game, and it was that night I was watching Charlie Rose, which is a TV show with somebody talking in front of a black screen. And to understand how mental illness strikes, it doesn't strike as a thought for someone like me. It strikes as a feel. Like you're watching TV, and I'll never forget it, and they're talking to the security expert, Charlie Rose, and all of a sudden I feel my chest just kind of move, and I was like, are they talking to me? And you feel this energy come over you. And it feels like you're part of things. And all of a sudden you go on another channel, and somebody else is talking about winning an award, and all these things you're going to get, and you're like, are they discussing this for me, for what I'm doing? And it starts to feel like a lightning. If you ever hear somebody describe mania, it starts to almost like move through you like energy. And you'll hear the part about people not sleeping. And I started not sleeping. I would just be agitated at first, and I would speak a little quicker. But being that I'm from New Jersey, kind of blended. Everybody in Memphis walked very slow. So in Tennessee, they think we all have mania. But as I was talking and going, the hardest part about mania kicking in was, one, my family started to realize it, and two, the story starting about my daughter in my head. And the idea that I loved her. In my mania, I loved her. But I knew I would leave her. Because I just felt like there was money somewhere for me. There was a car with millions of dollars. And I just had to find it. And I remember spending 3 days in the house with my wife. And we knew we were going to get divorced. And she was right to get rid of me. And I remember walking in that last day in Ashley's room. And I don't know if you've ever held something in your hand that you love more than anything, because after what happened with my father, I knew I could never open myself to someone again. And Ashley was so beautiful and so young, and I picked up Ashley, and I held her in my face, and I kissed her goodbye in the way that you kiss goodbye to somebody that you're certain you'll never see again in your entire life. And that was 1994. I've never seen Ashley again. I stayed away for 13 days. I went down to Dallas, Texas. I got a tattoo in my chest in a manic episode, and I woke up in a mental hospital in Belle Meade called Carrier Clinic. And I woke up in the acute ward. And Carrier Clinic, and you wake up, you don't know where you are. If you want one tip for treating somebody with serious mental illness, if you have them wake up in your facility, tell them where they are, the day it is, the time it is, and how long they've been out. I woke up with 4-point restraints. It's a misdemeanor, you're bipolar, you're alcoholic, you're all these things. You can do anything. This is what I like when I talk in New Jersey, if you understand this. They say you can do anything except become a senator. And I remember being totally pissed off. I was like, really? You know, why can't I be a senator? I feel like I can do it. And now, watching the election, I can definitely be a senator. Like that. There's no way I'm any crazier than anybody else. So I think about those things. But, and like most people, when you see, the hardest thing to do is to start accepting the disorder. Because no one shows you a path to try. It's a lot of hard work. I'm very lucky on what I do. I'm on the steering committee of the largest psychiatric event in the country called Psych Congress. I'll be in Providence tomorrow at an adolescent hospital doing regional training Saturday. There are certain breakthroughs in psychiatry, but honestly, very few. There's very few new drugs. You know, it's a population of people that there's just not a lot of money spent on. Oftentimes, still, the best treatment is lithium, which is from the 50s. And nobody knows why it works. And while we do have some screenings through functional MRIs on how the brain works when mentally ill and psychotic, we have almost none on etiology. So this is a very dynamic time to sit there and see that what they're studying is full body reactions. That there's as much gray matter, cortical matter, in the gut as there is the brain. How we're starting to see connections to persistent stress, genetic changes due to cortisol. that we really, I was just lecturing yesterday at the medical school on faculty, and what we don't know would scare you. What we don't know would scare you. So what's very hard when you can't show somebody, and we all hear this, right? Show me the blood test. That's patient's big thing. Show me, prove to me I have this. Prove to me, and it's faulty logic, because you can have a heart condition from stress. You can have an enlarged left ventricle just based on high levels of stress and the blood pounding in and out. It's not necessarily important exactly where it comes from. What's important is people die from this disease. And they die early. So I wouldn't accept it either. And after I got out of carrier, a lot of people do. I tried to use school, so I went to NYU. And I registered at NYU, and I was going to be a great success story. But I registered on a drug that you really wouldn't recommend for people with bipolar disorder. It's called cocaine. And that didn't work. And I had a full manic episode at NYU, and this time I ended up in the VA hospital at Lyons, building 53. And that's when they said I would die there. They sat my family down and they said nothing's worked, he's following the path of his father. And that's where the illness ran a real devious course. That's where I wouldn't sleep for days. I would jump bed to bed with a crucifix on my neck. And I would feel as if, you have to understand the limit of illness feels, especially people psychotic and manic, is the idea it feels like energy, and then the narrative develops. So if you're going to sit there and work with somebody, especially what I do for a living, the way you're going to connect to them is through their physiology, not through their thinking. It's to sit there and realize what the suffering is. In my own case, jumping bed to bed, I tried to hurl myself out of a window. I slept under bed smoking cigarettes. I ate cigarettes out of the urinals. And eventually it just kept restraining and restraining and restraining me. Until eventually I took an act where I tried to kill them over. Which is why I do what I do for a living now. They had cornered me, which really you should never do, but it's not their fault. They stepped in and they broached my proximity, and I remember throwing a punch, and I didn't want to write it in the book. I didn't want to totally put all these things out there. And that's when they held me in restraints for 24 hours. And the hardest thing about that time in restraints is, at about 10 hours in restraints, the suffering is so physical that you don't even have thoughts. You're just begging to die. And I remember clearly that the thought I had all the way back to the last time I saw my father on a church altar when I thought he would kill me. I was just convinced that it all had to end then. That there was no way out. And I screamed over and over again in the night for someone to kill me. And what happened was a nurse came in and started wiping down my head. If not, I would have had a heart attack in restraints. I would have survived. To this day, just knowing the symptoms I still carry, if my daughter surprises me and goes to hug me, I go into a full shutdown and I can't feel anything. But I know enough from what I do how to sit there and bring it back. What happens to people while they're psychotic, they remember the rest of their lives. We're not animals. Even if it seems like we're acting that way. And the intervention that worked for me is when they took me out of restraints, I couldn't walk, and they dragged me down to the end of the hall, and they brought in a therapy dog. And it's very funny, someone asked me one time, is that the dog? I was like, no, I didn't have a camera for it. And it just turns out that they happen to have this dog. And what's very nice in this picture is this is the exact dog that they had. And it was the first time that somebody took their time with me and didn't look disgusted at me. When I was done with human beings, that wasn't going to save me anymore. And I held that dog, and oddly, that was the beginning of my recovery. Lucky enough, there's a large organization called the Substance Abuse and Mental Health Service Administration, as I hear SAMHSA. So SAMHSA had a big 5-year recovery grant. I was one of the faculty members on it throughout the country with the psych nurses. And we did a whole program showing how recovery can start in the hospital. Because so many people, that's where it starts, and they never want to go back, and that's where it started for me. So to get to where I am today and to try to figure it out, there's a painting by someone named Jose Orozco, and this is oftentimes why having stigma functions are so important, is you're asking people to build an entire life back, and to change your life is very difficult. For a family to change your life is very difficult. The payment process is a lot to try to figure out how to live with the things we're talking about, how to move through them, how to deal with side effects. Lithium, eventually I gained probably 60 pounds on lithium. I had boils on the side of my head. I shook. I didn't understand why I took these things, but I had people around me that made it seem like it was worth doing. That's why I'm glad we're talking about addiction as well. The thing that really saved my life was an addiction community. Now, they weren't ready to treat the mental illness, but I saw people getting better. I saw people discussing what it's like to really suffer, and that means something. That you can use it. That someone's not lying to you. And what happened to me is eventually, for all my treatments, there was addiction, there was mental illness, and there was trauma. And what you're going to see right now, with about 30 years of science behind it, coming to underlie everything, are these functions around the adverse childhood experience study and showing when somebody has, out of these 10 questions, and this is originally from Kaiser Permanente, if somebody has an answer of 2, just 2, that there's like a 600% higher chance for serious mental illness, addiction, suicidality. And why that's important today, especially speaking at a medical facility, is the idea that when the system starts running hot, in these chronically stressed systems, anything can go wrong. And that mental illness is a physical process. Mental illness is not something that just happens out in the wind. It's a physical process that has so many other comorbidities that we have to look at and discuss. And be able to see what it means, which is exactly what Vicki was talking about, when people have these type of things and they start experiencing what they call early death in the case of serious mental illness 25 years earlier. There are ways to work in this. There are ways to go into hospitals and deal with people with serious mental illness and look more at their physiology, which now everybody has metabolic syndrome. And metabolic syndrome is as much of a function as a persistent stress response. There's nobody has any idea why people with serious mental illness have it. But the cardiovascular problems, as well as the problems with metabolism, come from a lifestyle of constant stress. Of walking into these facilities and seeing, and if your heart rate is higher. And when you start hearing people with serious mental illness, oftentimes it's generational. If you've ever been to a partial care program, very few diseases take you completely out of everything you know, except for this. And that's why it's nice places like anti-tab and things like that that really show what a life is supposed to be. What are we recovering? When the symptoms stop or they keep doing, what are people trying to recover? And that was really what I was trying to get to when you sit there and you think about the brain this way, which is vertical. Under stress, you lose all these parts. And think of the lifestyles people live in. It's easier if I show it to you this way, because those words might not mean anything to you. But if you can keep someone calm by making them safe, certain, and giving them efficacy, their whole body works better. The medications work better. Your employees work better. But it's understanding that someone with mental illness deserves interventions like that. Because once somebody gets down here, we're all the same. These are the deep parts of you that explode. The things you're afraid of in de-escalation and emergency rooms. When you think somebody's going to be violent, if you're acting a certain way, guess what? You're going to bring it out. There's just a fact that way. And people like my father and myself deserve interventions to at least make someone feel safe, to walk through it, and to see. So it gave me another way to see myself. And I was able to treat myself in different ways. I've never had treatment for any of these things. I've never had a therapist in my life ask me about my child abuse. Never once. You say you're bipolar, that's what they ask about. You say you have addiction, that's what they ask about. Yet I had every one of those issues, and I lived with them. But I knew that I wanted a life that was not going to be determined by everything that had gone before, and I knew one of the things I had to do was learn how to forgive my father and get over that stigma. And could I see him? And that is brutal, because I hope many people in here have family members that have mental illness, and even if it's hard, I hope you still have a shot with them, because my father is dead. My life now with my father is, how do I tell my daughter about my father? How do I acknowledge that my name is Eric Erouse, son of Ira Erouse? And what I realized, it wasn't going to be just understanding the disorder. It was going to be understanding that my father loved me. It was going to be able to walk through and know him before he had the disorder. And he had dreams. And he wouldn't have wanted to kill me. And I did that. I went back to the hospital where I was restrained, and I sat under the window. And I asked my father for his forgiveness, because I couldn't save him. And in 2004, I left the management job, the largest shipping company in the world, and took an $800 a month job to be a consumer, to try to figure out how I could do the most with my story until eventually where I ended up where I am today. I've won every national award you can win for advocacy. Intellectually, I've created all these things throughout the country. Next year, I'll start a doctorate at Johns Hopkins University. All those things are done in honor of my father. Because if I live with that same lifestyle, then I'm never going to get out of that bed. And I'm not saying this will happen for everyone, but this has been 20 years of work. 20 years of coming to grips with what's going on. To finally sit there and say the only thing I ever wanted in my life was to A, fix a relationship with my stepdaughter. And 3 years ago, while I was presenting in Illinois, Facebook has private messages. My ex-wife wrote me a letter, and part of my amends to her was that I would stay friends with her. And I married my current wife in 2008, Cheryl. She's the most amazing person. And she wrote me a message, and it said, Eric, I have to tell you something I've never told anyone. And I said, what? And she goes, Ashley was the baby of a rape. And you can watch her whole life change right there. And I took a shot I'd never taken before, because one of the things you find out, especially if you get to win every award you ever think you could want, is they don't mean anything. You want those things around your personality, your humanness, and your heart, the things that we disregard with people with serious mental illness. And I wrote to my ex-wife, I was like, could you tell Ashley that I love her? And that I would have never left. And she wrote back, Eric, she read the book, You're Forgiven. And my entire life changed on that moment. And in 2009, I had a daughter named Olivia. And I'm going to have to sit down and tell her my entire life story. And what they've shown is one of the few ways you can have any type of prevention with serious mental illness is to teach your child how to self-regulate. And my daughter is all the things that I hoped for. And she'll never know this, but she's the only answer I think that keeps me going anymore. Because now everybody I see in the hospitals, everybody I see with addiction, everybody I see suffering was somebody's daughter, was somebody's son. And knowing what I know for a living is most important to me, is my daughter's not afraid of me. So I didn't deserve to have this recovery, but I deserved to be able to be a father and to be able to pass down the things that make me proud of myself and not just the things that made me hate myself. So today I leave with the things I've done right. And in the state of New Jersey, I've done lots of things to be proud of. The thing I'm most proud of is being here tonight and hoping that I offered you a different story about somebody who's been on these same streets, walking around completely psychotic, who is now living the life that he always dreamed about, but still with the same exact rules that let me remember exactly why I'm doing it. So thank you very much for all you're doing here in Englewood.